Today I'm talking to Dr. Iain Simpson, consultant cardiologist at University Hospital Southampton and president of the British Cardiovascular Society. Thank you for coming, Dr. Simpson.
You're very welcome. Thank you for inviting me.
What is the best thing about being a cardiologist?
Oh gosh, how long have you got, I would say. I think actually the best thing is that cardiology is such a diverse specialty. You see outpatients, you see inpatients, but there's a lot of procedural based action in as well. Your permanent pacemakers, angiograms, lots of imaging, heart failure. It's incredibly diverse. I would say it's variety, and as we know, variety is the spice of life.
What's one thing that you think all doctors should know how to do?
I think it's communicate with patients. It's one of the things that's almost a sort of given that people assume you know how to do it. But in reality, it's making people feel comfortable is part of what we do. And I think in a technology-driven specialty, we often forget that that's so important. So for me, that would be the most important thing.
What makes you happiest?
This sounds strange, but actually, maybe not so happiest, but what I get most out of, and I think what I get most out of, is actually doing my job, but strangely enough, doing it generally in the middle of the night. So you have a heart attack patient and I'm an interventional cardiologist, so I do a primary angioplasty rota. And actually when you come in at 3 a.m. and you have a really good team of people around you, you're treating a patient that actually you walk out and think, I've done a great service to that patient.
What book do you think everyone should read?
Well, I suppose if you're talking everyone in medicine, then I guess it's probably something like The Houseman's Tale. But actually, I would probably say what my favourite book, or at least the one that had such an impression on me, and that was The Grapes of Wrath by John Steinbeck. Quite a powerful book, not the sort of thing that you want to read if you want to feel cheery at the end of it, but an incredibly impressive book, and that would be, I guess, the one I would say everyone should read.
What do you think is going to be the one biggest change in your specialty in the next 5 years?
I think that's very difficult to predict in cardiology. You know, the fascinating thing about cardiology is it's always moving forward, and it's moving forward at such an incredible pace. I looked back, indeed, I had to give a lecture to our medical students, and I thought, I'll actually tell them what cardiology was like when I was a medical student, and then compare it with what it's like now. And the things that have changed in such a short time scale, because obviously it's not that many years ago since I was a medical student, have been extraordinary. So actually, I really don't know. I guess you would have to say stem cell therapy would be the obvious thing. But looking back on the developments and the real innovations in cardiology that have occurred in the last 20 years, I think it's very difficult to predict.
Which talent would you most like to possess?
I would actually quite like to play a musical instrument. I've never been I was forced, as many children were at my age, to do piano lessons when I was about 8 or 9 and gave it up as soon as I possibly could. But it's the one thing I would really love to be able to do.
And if you could choose a superpower, what would it be?
I think it would be travelling at the speed of light. I absolutely hate air travel these days, and it would be rather nice just to be able to turn up at wherever you want to be without having the hassle of air travel. So yeah, I think travelling at the speed of light, faster than a speeding bullet, I guess would be the appropriate phraseology.
What do you consider your greatest professional achievement so far?
I think it would have to be becoming president of the British Cardiovascular Society, because I think that it's a culmination of all the things that you do in your career. And because you're elected into the position by the membership of the society, I think that's what I find the most pleasurable about it, is that you have sort of peer recognition. So for me, that has very much been the pinnacle of my career.
What do you think is the biggest challenge facing cardiology today?
I think it's not just cardiology. I think it's the biggest challenge facing medicine. I think within the United Kingdom, we obviously have to grapple with a new design, new redesign of health services, commissioning of services. But I think the biggest thing we all grapple with is getting confidence of the patients. And I think there is a number of situations where we can potentially lose that. So I think it's gaining support and confidence of the patients that we continue to act in a professional manner, which is, I think, absolutely essential to good medicine.
And what would be your ideal meal?
Oh, well, of course, being from Glasgow, it wouldn't be a deep-fried Mars bar, but it would have to have anything with chips, probably steak and chips. Very, very unhealthy for a cardiologist, but in moderation, obviously, with a good glass of red wine.
What is your favourite sound?
Silence, I think.
If you could sit down for a coffee with the Secretary of State for Health, what one thing about the healthcare system would you ask him or her to change?
I think I would say you need to give the responsibility and the power back to the doctors, and it needs to be back to the doctors who actually can take that responsibility and run with it to develop the health service. And I think that is the one thing, overarching thing. I mean, obviously I have a whole list, but that would be the one. If I'm only allowed one thing, I think that's kind of where you never affect change in medicine without the doctors being on board. And actually, you probably don't affect change without the doctors driving it.
When you eventually retire, what will you miss most?
I think it'll be, well, two things actually. I'll miss the staff that I work with because it is very much a team effort what we do, and we have a fantastic team of people. So that I'll miss. I'll also miss the patients actually, because I love the interaction with patients and I love dealing with patients. And I think that would be a very difficult thing to walk away from eventually.
And finally, what do you think happens when we die?
Well, obviously, I don't know. What do I think happens? I think probably we sleep for a very, very long time and never wake up.
Thank you very much, Dr. Iain Simpson.
You're very welcome.
Thank you.